Hello and welcome to the second episode of our Smart CBT video series. In this episode, we will discuss trauma, explain what this is, symptoms associated with it, and which local support services are available to you. Psychological trauma can be caused by stressful, frightening or distressing events. Following a negative event, it is common to experience negative emotions, intrusive memory recall and sleep disturbance. This would be classed as an acute stress reaction. If these symptoms last longer than 1 month, you may have post-traumatic stress disorder. PTSD is diagnosed when you have been exposed to death, threatened death, actual or threatened serious injury. This includes direct exposure, witnessing the trauma, learning that a relative or close friend was exposed to a trauma, and indirect exposure to aversive details of the trauma, usually in the course of professional duties. The traumatic event is persistently re-experienced in the following ways, reliving all or aspects of what happened. This can include unwanted upsetting memories, intrusive thoughts or images, nightmares, vivid flashbacks and feeling like the trauma is happening right now, emotional distress after exposure to real or symbolic reminders of the trauma, and physical reactivity after exposure to traumatic reminders, physical sensations such as pain, sweating, nausea, palpitations or trembling. Avoidance of trauma-related stimuli after the trauma can include trauma-related thoughts or feelings, trauma-related external reminders, feeling like you have to keep busy, avoiding anything that reminds you of the trauma, being unable to remember details of what happened, feeling emotionally numb or cut off from your feelings, feeling physically numb or detached from your body, being unable to express affection or enjoyment, and using alcohol or drugs to avoid memories. Negative thoughts or feelings that began or worsened after the trauma can include feeling like you cannot trust anyone, feeling like nowhere is safe, feeling like nobody understands what happened to you, blaming yourself for what happened, overwhelming feelings of anger, sadness, guilt or shame, inability to recall key features of the trauma, overly negative thoughts and assumptions about oneself or the world, exaggerated blame of self or others for causing the trauma, negative effect, decreased interest in activities and or hobbies, feeling isolated and difficulty experiencing positive effect. Trauma-related arousal and reactivity that began or worsened after the trauma can include panicking when reminded of the trauma, being easily upset or angry, extreme alertness, also sometimes called hypervigilance or hyperarousal, disturbed sleep or lack of sleep, finding it hard to concentrate on simple everyday tasks, being jumpy or easily startled, self-destructive behaviour or recklessness, irritability or aggression, risky or destructive behaviour, heightened startled reactions and other anxiety symptoms. Diagnosis includes that the symptoms last for more than 1 month and that the symptoms create distress or functional impairment including social, occupational and hobbies, and that the symptoms are not due to medication, substance use or other illness. In addition to meeting criteria for a diagnosis, an individual can experience high levels of dissociation in reaction to trauma-related stimuli. For example, depersonalization is the experience of being an outside observer or detached from oneself, for example, feeling as if this is not happening to me. Derealization is the experience of unreality, distance or distortion, and feeling that things are not real. PTSD may be described differently in some situations. Delayed onset PTSD is if your symptoms emerge more than 6 months after experiencing the trauma. This might be described as delayed PTSD or delayed onset PTSD. Complex PTSD is if you experience the trauma at an early age, within your attachments, or if it lasted a long time. You might be given a diagnosis of complex PTSD. Each person's experience of PTSD is unique to them. The Diagnostic and Statistical Manual of Mental Health Disorders focuses on the stresses of being exposed to death, threatened death, actual or threatened serious injury. But any event which leaves you emotionally overwhelmed, shocked or isolated can result in unprocessed memories. Therefore, trauma responds often long after the event. It is not actually the event or circumstance which determines whether the situation is traumatic. but it is the emotional experience and interpretation of the experience which causes the problem. A flashback is a vivid experience in which you relive some aspects of a traumatic event or feel as if it is happening right now. This can sometimes be like watching a video of what happened. But flashbacks do not necessarily involve seeing images or reliving events from start to finish. You might experience any of the following: seeing full or partial images of what happened, noticing sounds, smells or tastes connected to the trauma, feeling physical sensations such as pain or pressure, and experiencing emotions that you felt during the trauma. You might notice that particular places, people or situations can trigger a flashback for you, which could be due to them reminding you of the trauma in some way. Or that you might find that flashbacks seem to happen at random. Flashbacks can last for just a few seconds or continue for several hours or even days. Trauma occurs as a result of physical harm, such as accident or injury. Ongoing stress, such as a current event in your life or something which happened in the past. Emotional, social, interpersonal or sexual harm. So what actually is trauma then? Well, the parts of our brain that deal with overwhelming events have been among our brains for a very long time. The brain regions which play an important role in trauma include the hippocampus, amygdala and the prefrontal cortex. The oldest regions of our brain responsible for our fight, flight or freeze responses can switch on very quickly and sometimes not switch off again. Our prefrontal cortex tries to make sense of these survival reactions, producing faulty appraisals. The brain can default to these survival reactions long after the danger has passed. This is the major issue of trauma. The good news is, though, they can be switched off too. If you are experiencing symptoms of PTSD or trauma, you might also find that you have difficulty with some aspects of your life, such as looking after yourself, holding down a job, maintaining friendships or relationships, remembering things and making decisions, your sex drive, coping with change, and simply enjoying your leisure time. Complex post-traumatic stress disorder is a condition where you experience some symptoms of PTSD along with some additional symptoms. These include difficulty in controlling your emotions, feeling hostile or distrustful to the world, constant feelings of emptiness or hopelessness, feeling as if you are permanently damaged, feeling as if you are completely different to others, feeling like nobody can understand what happened to you, avoiding friendships and relationships, and often experiencing dissociative symptoms such as depersonalization or derealization and regular suicidal feelings. The main treatments for trauma are psychological therapies and medication. Trauma can be successfully treated many years after the event was incurred, meaning that it's never too late to seek help. Before being treated for psychological trauma, detailed assessment will ensure that you are receiving the best treatment for your individual needs. The psychological therapies which can be used to treat individuals with psychological trauma here at Smart CBT include cognitive behavioural therapy and eye movement desensitization reprocessing therapy. Cognitive behavioural therapy aims to change how you think and how you behave to help manage your emotions. Trauma-focused CBT uses various psychological techniques to help the individual come to terms with a traumatic event. Your therapist will help you deal with negative emotions, body sensations, and thoughts about your experience. CBT also focuses on changing your behaviour by gradually reintroducing any activities you may have avoided since your experience, or which may help you overcome trauma. Eye movement desensitization reprocessing therapy involves bilateral stimulation intended to stimulate adaptive information processing in the way that your brain naturally processes memories and experiences whilst you are sleeping. EMDR has been found to help change the negative way you think and feel about a situation or a traumatic experience, and is particularly good for working with imagery and body sensation, as it is often our body that is holding the source of trauma. This type of treatment can access and process unconscious material fueling our current symptoms. In addition to Smart CBT, there are a number of local organisations around East Anglia which provide support for those with psychological trauma and PTSD, including but not limited to the NHS Suffolk Wellbeing Services, Mind, a mental health charity which can help you make choices about treatment and signpost you to the most local support services, Survivors in Transition, Rape Crisis, providing specialist support in local support services for women and girls who have experienced sexual violence, Victim support, with local support services in Suffolk, Essex and Norfolk providing support to victims and witnesses of crime. Cruise, a UK charity with local support centres and information for individuals who have experienced bereavement. And Combat to Coffee, set up by former Royal Anglian Nigel Seaman. Combat to Coffee is a support outlet for armed forces veterans who may be struggling with life outside of service. Thank you for watching our trauma episode of our video series here at Smart CBT. We hope this video has informed you about psychological trauma and what Smart CBT and local support services can do for you. Stay tuned for future episodes, and thank you for watching and see you next time.